Hi, I hope everybody is doing fine. Dr. Mudassar Jas here, and you people are watching my YouTube channel. And today I'm gonna discuss some aspects of OET letter writing. Like OET is Occupational English Language Test, and it is specifically designed for doctors, nurses, and other healthcare professionals. It has got four subtests: reading, writing, listening, and speaking. So today I'm gonna discuss OET writing. And OET writing has got letter writing, and letter writing has got different types of letters. Okay, you're supposed to write like different types of letters. Okay, in exam usually they'll give you case notes. Case notes means you'll be given some information, haphazard information, scattered information about the patient, and on the basis of that information you need to write a coherent letter. Okay, and there are different types of letters that I'm going to discuss in today's session. Okay, first is simple referral, second is urgent referral, third transfer letter, then update and discharge letters. Okay, there are five types of letters, so just stay with me till the very end of this video, because in this video I'm gonna discuss in detail about each and every type of letter. So first is introduction to OET letters. That is like the most important thing that is like that is related to OET letters is professional communication. Like you see, a doctor is talking to a doctor is communicating to another doctor, a doctor is communicating to a nurse or other healthcare professional through this letter. So this is very professional communication, a formal, sophisticated communication. Okay, so you need to know that letter writing is a formal type of writing. It's not casual. And another important thing is you need to include only the relevant material provided to you through case notes. Okay, you only need to pick and choose relevant material. Okay, so now going into the details of each letter. So simple referral letter is the first type of letter. So by definition it is a type of letter where uh, letter is being written to another healthcare professional, usually specialist, for assessment and management. Here you need to know that usually in Western settings, healthcare settings, GP usually writes a referral letter to a specialist. But here in the context of subcontinent, you'll see doctors, mostly junior doctors, medical officers working in primary care setting, BHUs, RHCs, THQs, they are writing referral letter to specialists working in tertiary care hospital. So in the context of Pakistan, you need to keep in mind that tertiary care hospitals are like big hospitals, New Hospital Lahore, JPMC Karachi, similarly PIMS in Islamabad. These are tertiary care hospitals. So usually it is written from GP to specialist. Again, the referral letters can be of two types. One is simple referral, other is urgent referral. So in order to understand the simple referral, you need to know that you just keep in mind that you are a doctor working in a primary care settings, and a patient comes to you with some minor complaints like throat infection, skin problem, skin rashes, and there are multiple visits, and you have given him some treatment but patient is not getting better. So now you and the patient both decide that it's better to take expert opinion. So then you refer that patient uh, to ENT specialist, just to get his expert opinion regarding assessment and management. Okay, so this is simple referral. And similarly, like you can just add scenarios. There are multiple scenarios where these referrals are happening. But referral can be of urgent case as well. So there is another type of referral that is called urgent or emergency referral, where a patient is referred like in emergency department. For example, uh, again you just need to keep in mind that you are a doctor working in a primary care setting in BHU, RHC, uh, THQs, and patient comes to you in emergency situation like severe chest pain radiating towards left side associated with sweating, so on and so forth, and it's like a suspected case of myocardial infarction, heart attack. So in such a scenario you need to refer him urgently to the emergency department. Okay, so this is so the difference between like simple referral and urgent referral is like in urgent referral you need to focus on the present scenario, his present symptoms, because of course he is going through a very difficult phase. There are chances that if he is not being treated urgently, eh, he can have some problem regarding his life. Okay, morbidity is usually high in such scenario. That's why you need to focus on the present circumstances, although you need to include his past visits details and his background history as well, but your focus is usually on the present state, current state. Okay, then you need to like of course see in the simple referral things, you starting it in a chronological order from background history, first visit, second visit, and 2 days visit, and then you need to end it. Okay, you are not that much focused in the present context. Then the third type is transfer letter. In the transfer letter is usually happening, you need to keep in mind that in transfer letter patient is being transferred from one ward to another ward inside the same hospital. You're not transferring that patient from one hospital to another hospital. Usually it happens from one ward to another ward. For example, patient is admitted in orthopedic department because of femur fracture, and patient is like he has been operated upon, he's like mobile, post-op care is okay, he's vitally stable, but the consultant on duty says that he needs some time in the rehabilitation unit as well. So you are transferring that patient to rehabilitation unit just to make sure that his physical movements are good. So that is a sort of a transfer letter. In transfer letter, we don't usually transfer that patient from one hospital to another hospital, from one city to another city. It usually happens from one ward to another ward, from like orthopedic ward to rehabilitation unit, from medical unit to psychiatric unit, so on and so forth. Okay, then comes update letter. In update letter you need to keep in mind that update letters are usually written from tertiary care hospital, specialists from tertiary care hospital, to their GPs, to the GPs of the patients. Okay, so as the name suggests that you need to update somebody who knows something about patient. Okay, as in the western setting, GP knows each and everything about the patient. So in such a scenario you need to update the GP who has referred a patient to you. Just keep in mind that you are working in a tertiary care hospital uh, in a cardiology department, and GP referred a patient to you a couple of days ago. Now you have admitted that patient, you have started treatment, you have ordered certain tests. Now you are writing back to GP regarding explaining the current situation of the patient. So that is update letter. You are updating GP about the patient's current status. That is called update letter. Then comes discharge letter. So just keep in mind the previous example of a patient who was admitted in the cardiology department. So in such a scenario, that patient, it's been a week or couple of weeks, and like since patient's admission in the ward, he's hemodynamically stable, his ECG is okay, his vitals are okay, he is mobile, exercise tolerance test is okay, so each and everything is within normal range. So now you decided to discharge that patient. So in such a scenario, you need to write a discharge letter. So in discharge letter are more, focuses on, you know, on the follow-up plan, because now patient is being discharged and being followed up. being discharged and then being discharged back into the care of GP. So you need to instruct the GP formally regarding patient's follow-up plan. Okay. Then comes the key differences between letter types. Okay? So referral letter is usually routine assessment, urgent referral is immediate assessment, transfer letter is handover care, update letter is updating GP, and discharge letter is about in like follow-up plan. Then comes like some generalized tips about OET writing tips. Identify the reader. You need to, reader is here is the person to whom you are referring that patient or you are writing that letter. Okay, usually the like the other doctor to whom you are writing that letter. Then comes purpose. Understand the purpose means like type of letter. Then select relevant notes, organize logically, use professional language, highlight urgency when needed. Okay, so these are few generalized tips and tricks regarding OET letter writing. Last but not the least is exam strategy and conclusion. So before ending it, I must request you people to please like this video, share this video and subscribe to my channel. So exam strategy and conclusion is read case notes carefully, identify letter type, identify reader, select relevant information, plan structure and ask does the writer, what does the reader need to know. Like for example, you are writing a letter to cardiologist. So in such a scenario, you need to keep in mind that what the cardiologist needs to know regarding the patient.